Your eyes are often the first thing that people notice about you. And as we age, though, often eyelids start to droop just a little bit. But Dr. Justin Johnson is here to tell us about ways to get those eyes looking more refreshed and vibrant. Dr. Johnson, are droopy eyelids a problem for a lot of people?
There's a significant amount of the population that has droopy eyelids, especially as you get older. Your eyelids tend to droop and sag.
And how do you fix them?
Well, the easiest way to fix them is through what's called a blepharoplasty, which is an eyelid lift. So basically you remove the skin and extra tissue. Also, a lot of the time you have brow ptosis in addition to eyelid droopiness, so you fix the eyebrow as well.
Now, is that just like a lift on the eyebrows, or what happens there?
Well, it's basically a forehead lift where we make small incisions in the forehead and pull the brows up while we're lifting it.
I would imagine that gives you a more awake, refreshed look when you do all that, right?
It definitely does, definitely does.
You mentioned the incisions. How do you, when you're doing the eyelids, what exactly is happening here on the eyelid procedures?
Well, basically, you can see on the left she has, extra eyelid skin. So what we did was we used a laser and we marked off how much extra eyelid skin she had. We made the incision with the laser, removed the skin with the laser, removed a little bit of the fat as well. She had some extra fat, and then we closed it back up.
So it's all done with lasers. It's high-tech and streamlined, right?
Correct, which leads to less bruising and swelling and quicker recovery.
Well, you talk about the recovery. What kind of, as we're seeing some of these amazing before and afters, what kind of recovery time do people need after they have the procedure?
The average person, depending on what they have done, is anywhere from 5 to 10 days. 5 to 7 if you have an eyelid lift, 7 to 10 if you have a forehead lift with it.
What age do you think is a good age for someone to come in and say, hey, do I need this done?
Well, any age is good if it's bothering you. We've had people as young as 18 and as old as 96 have the procedure done. But it generally skews around 45, 50, somewhere in that range.
But there's not a certain age where you say, I've got to get it done now, I'm 40, or I've got to get it now when I'm 60. So you could actually, if you're having problems, even if you were younger than the typical age,
correct,
you could still be a good candidate
correct,
for this.
Yep.
When we talk about someone being a candidate for this, does insurance cover this sometimes, all the time? How does that work?
Yeah, insurance does cover it under certain situations, and that's a significant amount of the time. Basically, if you have tissue that's pushing on your lashes, or you have some visual field loss, like you feel like something's blocking your vision, and they'll also cover it occasionally for migraines. We do a lot of these for migraine headaches.
Well, you talk about migraines. Does that, eyelids, do those sometimes, the sagging eyelids sometimes cause migraines?
Well, what happens is in some people who have migraine headaches, they have a muscle spasm. So the muscle spasms right here and then goes backwards, setting off a migraine. So during the forehead lift, we actually disinsert the muscles here, which gets rid of that spasm and basically cures the migraine. So certain populations benefits from it greatly.
And people really who have been plagued by migraines can have that alleviated in some cases by just having the procedure?
Yes, that is correct.
Well, you have some special deals for pricing going on right now, right?
Yeah, so we're running some special deals on our Radiace, our Juvederm, and our Dermapen. So the Radiace is $100 off, our Juvederm is $150 off, and our Dermapen's $100 off for those who mentioned KSL Studio 5.
So these are in addition to the eyelid lifts. These are other procedures if people want to look a little younger and fresher, right?
Correct, correct.
Great ideas right there. Website, how do people get a hold of you?
It's eyelidexpert.com. Pretty easy to remember.
Okay, thanks, Dr. Johnson.